The problem is that doesn't translate to the university should probably be encouraging people more, when they're 30 or 35 or 40, like the stages I'm maybe getting at now, get out there and get your ideas and like move on and know when to let go of those people. Because what happens to those people, they get frustrated. They maybe don't want to go through that grant treadmill anymore. They get jaded. They end up in maybe administrative positions or so on. And that's kind of that mid-career burnout. Versus if there was a clear path and incubators and mentorship for mid-career people to like get out there and do something, and go and get funding, get jobs, work with industry, that would be the time to do it. And I think that's the part that I really find is missing. And if I would say I'm bitter at one aspect of my career trajectory, it's that like that wasn't ever offered to me or encouraged to me or that sort of thing. It was more like I kind of got to go and get permission to have an industry job and always be apologetic about it and so on. And we also train a culture of clinical trainees to like not work with industry and not talk to industry. And it's a dirty word and a bad thing. And we call it the dark side, right? Like think about how like the joke people say like, oh, you're working with industry now, you're joining the dark side. It's not the dark side, guys, because guess what? CIHR is not funding new devices, new drugs, bringing them to market, spending billions and risking it all. They're not doing that because that's not their role. It's not the dark side. It's the stuff that brings innovation and new medicines and new technologies for patients. It's a team-based approach. So I think we need to like stamp that out, that type of culture out in academic institutions and really stop having senior academic administrators making those draconian rules who've never really worked with industry and don't understand it.